the learner, you're here because you want to understand things better, right?
Yeah.
To get past the headlines without getting totally swamped.
Yeah, exactly. That's what we aim for.
We know you want solid insights, fast.
And that's what we try to deliver, extracting the key stuff for you.
So today we're tackling something that really goes more than skin deep. We're diving into how chronic wounds impact people's actual lives.
Mm-hmm.
Our source is a really comprehensive book, Wound Care Essentials, Practice Principles, and we're focusing on the chapter about quality of life and ethical issues.
Yeah, and while, the biology of how wounds heal is fascinating, we're really zooming in on the human side today.
Right.
What's it actually like to live with a wound that just doesn't heal? For months, maybe even years.
Exactly. So our mission, if you like, is to go beyond just the medical side and really understand the effects on quality of life.
The day-to-day stuff, the emotions.
Social connections, the whole picture. Okay, so let's maybe start there. What do we mean by quality of life in this specific context?
Well, broadly speaking, quality of life, or QOL, it's a person's individual sense of well-being. It's very personal,
Okay.
shaped by feelings, beliefs, values, social stuff, relationships. It's not like a fixed score. It changes.
So it's less about hitting certain health markers and more about how someone actually feels about their own life.
Precisely. And then there's health-related quality of life, HRQOL. That's the bit specifically affected by health and illness.
Right.
So symptoms, how well you can function, limitations, disabilities, how all that impacts you living your life.
Some very subjective.
It absolutely is.
Yeah.
HRQOL is based on what you think makes life meaningful, your goals, expectations, values. Even culture and society play a role. And what's really striking is how consistently the research shows chronic wounds have a major negative impact on QOL. It's just widely accepted.
Okay, significant and negative impact. Got it. So the source mentions 3 main types of chronic wounds. Can you walk us through those and how they maybe affect people differently?
Sure. The main 3 are pressure injuries, diabetic foot ulcers, and venous leg ulcers. Pressure injuries, or PIs. They happen when there's prolonged pressure, usually over a bony bit, cutting off blood flow and damaging tissue. You see them a lot across healthcare settings.
And these aren't just like a minor skin thing.
Oh, definitely not. The research shows patients with PIs have a much higher risk of bad outcomes.
Like what?
Longer hospital stays, becoming less able to do daily things, and quite worryingly, a 3.6-fold increased risk of dying within about 21 months.
Wow, 3.6 times. That's stark. So day to day, how does a pressure injury really hit someone's quality of life?
Well, studies pull out some common themes. Physical restrictions are big, needing changes to how you live, where you live.
Right.
Social isolation can happen, negative feelings about body image, losing independence. Then there's the burden of symptoms, pain, maybe odor, leakage from the wound.
Yeah.
Overall health can decline. It puts a strain on family, caregivers, financial problems, issues with treatment, even how they interact with doctors and nurses. It's a lot.
That sounds incredibly difficult. What about diabetic foot ulcers, DFUs? They seem really common.
They're a huge issue for people with diabetes. About 25%, 1 in 4, will get a foot ulcer sometime in their life.
1 in 4.
Wow. And these ulcers are the reason behind most lower limb amputations, like over 80% of them in people with diabetes.
That's terrifying.
And the mortality rates associated with DFUs are, well, they're shocking. Up to 55% within 5 years of getting one. And if there's an amputation, that can go up to 74%.
Wait, 74%? That's higher than some cancers, isn't it?
It is, yeah. It really puts the severity into perspective.
So apart from the amputation risk, how else do DFUs mess with daily life?
Well, mobility is a huge one. Problems with feet and ankles make just getting around really hard.
Yeah, I can imagine.
That obviously impacts work, potentially leading to job loss, money worries. Needing more help puts stress on caregivers, too. And anxiety and depression are really common.
And the source brought up something specific to DFU's stigma.
Yes, and this is so important and often missed. People with DFUs can face a lot of stigma. They might get labeled non-compliant, like it's somehow their fault.
Oh, that's awful.
It is, and it leads to feelings of failure, shame, embarrassment, and that stigma. It can actually stop people from getting help when they need it, or talking openly about it, or even sticking to treatment. It's this really damaging cycle.
Totally counterproductive.
Okay.
Third type, venous leg ulcers. What's the story there?
They're also pretty common, about 1.5 to 3 per 1,000 adults in North America, more so as people get older.
Right.
But importantly, younger people get them too.
Yeah.
Up to 22% have their first one before they're 40. Think about the impact on work, social life during those prime years.
Yeah, absolutely. Yeah. So what are the main QOL issues for them?
Again, some overlap. Physical symptoms are big. Pain, odor, itching, leakage, infection risk, but also challenges just understanding and managing the care, which can be complex. The relationship with healthcare providers is key, and then the social, physical, financial costs add up, plus the psychological hit, fear, anger, anxiety.
It really sounds like even though the causes are different, people are facing a lot of the same struggles.
Absolutely. Pain is a huge one across the board. It hits mobility, sleep, ability to work.
Yeah.
And then there are things maybe less talked about, but still awful, like itching that won't stop, swelling, drainage, odor.
Things that make daily life really hard.
Exactly. People struggle with work, housework, basic hygiene, social stuff. It often leads to feeling depressed, powerless, ashamed.
And just the effort of constantly managing it, hiding it.
Huge burden, yeah. Trying to cover bandages, feeling torn between practical needs and just wanting to look and feel normal.
Right.
And the source makes a good point about, patient engagement. It's vital. People are involved. But we also need to recognize the real difficulties of living with this stuff and not just jump to labeling someone non-compliant when they're struggling.
That's a really important nuance. Okay, so the material introduces this thing called the Chronic Wound-Related Quality of Life Framework. What's that about?
The HRQOL framework. It's basically a model to help understand the main stressors affecting QL for people with these wounds. Think of it like two circles, with the person right in the middle.
Okay, person at the center. What are the circles?
The outer circle is the big picture stuff. Social systems, politics, healthcare systems. The inner circle identifies 6 key stress areas that people commonly deal with.
And what are those 6?
Okay, so number 1, the wound itself and its treatment. 2, pain and other symptoms. 3, function and mobility, what they can actually do. 4, emotions and psychological state. 5, money resources, costs. And 6, social relationships.
That really pulls together everything we've been talking about.
It does. And as people become more disabled or symptoms get worse, they often have to cut back on activities, rely more on others.
Yeah.
So the framework really pushes for involving the patient, looking at their whole environment, mapping resources, and working together on self-management. The goal is always a personalized plan to improve their specific quality of life.
So it's about seeing the whole person, not just the wound.
No.
Okay? The next bit talks about the person coping with the wound. What does that look like?
Well, the experience is often described as isolating, debilitating, depressing, full of worry, lots of stress, basically.
Understandable.
And the source mentions Lazarus and Folkman's stress appraisal theory. The idea is stress isn't just the event, it's how you see it. Is it a threat? And do you think you can cope with it?
So it's about perception and perceived resources.
Exactly. How much a wound impacts you depends on what you value, what meaning you attach to the parts of your life it affects.
Right.
And coping well seems linked to things like self-esteem, motivation, feeling confident you can solve problems. Interestingly, one study found people who feel more insecure generally tend to expect more wound pain and feel more anxious.
That makes sense, if you're already feeling vulnerable. So we know stress is bad generally, but how does it specifically mess with wound healing itself?
Yeah, chronic stress really throws a wrench in the works physiologically. It ramps up hormones like vasopressin and cortisol. Vasopressin can constrict blood vessels, which might mean less oxygen and nutrients getting to the wound things it desperately needs to repair.
Right, less building blocks.
Exactly. And too much cortisol, the stress hormone, can suppress the immune system, interfere with cell activity, new blood vessel growth, collagen production, all critical for healing. Chronic stress basically slams the brakes on healing.
So it's not just in your head, it physically slows things down.
Absolutely. And there's good evidence. One study looked at healthy volunteers, gave them tiny wounds. People who reported more stress healed slower.
Wow.
And they also had higher cortisol levels. Another study compared stressed caregivers, people looking after someone with Alzheimer's, to a control group. The caregiver's wounds took significantly longer to close.
That really shows the mind-body link, doesn't it?
It really does.
So, given that, what can actually be done to help people cope better and improve their QLL?
Well, the source talks about cognitive behavioral strategies, psychosocial support, things aimed at helping people rethink how they see the stress, feel more in control. Research in diabetes, for instance, shows that psychological help, like teaching problem solving, goal setting, self-monitoring, can improve blood sugar control and reduce distress, which is obviously good for healing, too.
And there was a specific problem-solving technique mentioned.
Yeah, a pretty straightforward one. It starts with explaining the treatment clearly. Then, you work with the patient to pinpoint the specific problems they're facing.
Okay, define the problem.
Right. Then, set achievable goals together. Brainstorm possible solutions. Pick the best one. Map out the steps to actually do it. And then, importantly, check back regularly to see how it's going.
That sounds really practical, empowering.
It can be, yeah. Gives people a structured way to tackle things.
Okay, let's dive back into those specific stressors. What about challenges related to the wound itself and managing it?
A huge one is just how unpredictable healing can be. Even if someone does everything right, the wound might not heal, it might get worse, it might come back.
That must be incredibly frustrating.
Oh, yeah. Causes a lot of worry, frustration, feeling powerless. The book has some quotes from patients that really capture that feeling.
I can imagine.
And sometimes, even the best practice treatments cause QOL problems, like a total contact cast for a DFU might stop someone working or make them unsteady.
Right.
Or compression bandages for a venous ulcer make daily washing really hard. Or a noisy air mattress for pressure relief keeps someone awake all night.
Yeah.
Even just finding a comfortable position in bed can be tough, and some people just can't tolerate compression because of pain. Standard treatments don't always fit real lives.
It's this constant trade-off, isn't it, between treatment effectiveness and just living.
Absolutely,
Yeah.
which is why it's so crucial patients know their options and feel empowered to make decisions with their provider. And that includes feeling okay about monitoring things and speaking up if something's not right. Also, sometimes providers need to gently explain that in really complex cases, some skin damage might be unavoidable if the body's prioritizing vital organs. And crucially, explaining how wounds develop in a way that doesn't make people feel guilty or blamed is so important.
Reducing that self-blame. What about infection? That must be a constant worry.
Huge worry, yeah. Infection is pretty common, very upsetting, and it definitely slows healing. Patients often fear it's the start of something really bad: hospital, amputation, even death.
Understandably.
So providers really need to talk about those fears, set realistic expectations about infection risk, and explain what's being done to prevent or treat it.
Now, pain keeps coming up. It sounds like it's really central for many people.
It often is, yeah. One of the absolute worst parts. Wound pain messes with sleep, stops people moving, kills appetite, contributes to depression.
It's pervasive.
Very. Surveys show most people with chronic wounds have pain often or constantly, and even small pressure injuries can hurt a lot.
Right.
And that myth that diabetic foot ulcers are painless, not true. Up to half of patients do feel pain, and those with frequent pain have much poorer HRQOL. We really need better pain assessment and management.
Definitely. What about other physical symptoms that drag down QOL?
Well, pruritus itching is another common one, really bothersome, can be caused by skin irritation around the wound or even central nervous system stuff. Washing too much or irritants can make it worse.
So what helps?
Moisturizers mainly, sometimes specific drugs. Then there's wound odor. That's incredibly distressing, especially socially. Big issue with things like fungating breast wounds or DFUs.
I can only imagine how isolating that would feel.
Yeah. It's usually caused by bacteria, so management involves things like charcoal dressings to absorb odor and antimicrobials.
Okay.
And finally, exudate the leakage from the wound. It can damage the skin around it, make it sore and broken down. Plus, the leakage itself is embarrassing, can affect intimacy, so good absorbent dressings are key.
It's a whole cluster of difficult physical things beyond just the wound not closing. How does all this impact someone's ability to just function, do daily tasks?
Well, disability here means impairments like limited movement, but also difficulty doing activities and restrictions on actually participating in life because of the wound.
Right.
And most patients do have mobility problems, trouble with basic things like showering, getting dressed, walking, using public transport, climbing stairs. These become huge hurdles for many, especially with leg ulcers.
Leading to more dependence.
Often, yes. Which brings its own hassles and embarrassment. Modifying the home, thinking about accessibility, these become really important.
We've touched on the emotional side, but just how common are psychological issues?
Very common. People with chronic wounds generally experience more emotional problems, find it harder to cope with stress. Surveys consistently show high rates of mental health issues, with anxiety often being the most common.
It makes sense dealing with all that. What about the financial side? Chronic conditions are often expensive.
Hugely expensive for the healthcare system, yes, but also a massive hit for individuals and families. Many people can't work, especially with DFUs, because of mobility issues or fear of re-injury. This means lost income.
Right.
Plus, there are out-of-pocket costs. Transport, special supplies, medications, maybe home help. It can lead to real financial hardship. Providers really need to be aware of this and show empathy.
Absolutely.
Yeah.
And lastly, social life, relationships. How are they affected?
Well, embarrassment about odor or leakage, like we said, often leads people to avoid social situations. Isolation is a real risk.
Feeling cut off?
Yeah, feeling detached, struggling to keep up relationships, losing that social support network. But on a positive note, some studies, like those on nurse-led leg clubs, show that group support and social interaction can really boost QOL, morale, self-esteem, even improve pain and function.
So connection helps.
Definitely.
Yeah.
And social media is playing a growing role too, providing virtual support, especially in things like diabetes management, though its impact on, say, getting people more physically active seems mixed.
Interesting. Okay, the last part of the source looks at navigating the healthcare system, the social context, even politics. What are the key points there?
Navigating healthcare can be confusing, so having a trusting relationship with your provider is vital. Patients really value clinicians who are caring, see the whole picture, are knowledgeable, and communicate clearly.
And they don't like being rushed.
Definitely not. Feeling rushed or not listened to is a major frustration. Then there's the wider issue of stigma. Again, society seeing wounds as unattractive, imperfect, even repulsive. This really damages self-esteem. Wound clinics can sometimes be the only place people feel understood.
That's quite telling.
And finally, politics and policy matter. Health policy dictates resource access, funding, staff training. For example, whether things like pressure relief mattresses or compression therapy are actually reimbursed makes a huge difference, but in many places they aren't adequately covered.
So access to essential care can be a postcode lottery.
In many ways, yes, it creates real barriers.
This has been incredibly eye-opening. A really deep look at the ripple effects of chronic wounds. If you had to sum it up, what's the single most important takeaway for our listeners?
I think the key thing is realizing chronic wounds are so much more than just damaged skin. They reach into almost every single part of a person's life.
Yeah.
Physical comfort, ability, emotions, mental health, social life, finances. It affects the whole person profoundly.
Absolutely. It just hammers home why a holistic approach is so necessary, doesn't it?
Exactly. We can't just focus on closing the hole. We have to look at the patient's overall quality of life, their pain, their feelings, their social situation, their money worries, and make addressing those things a core part of the care plan.
So here's something to think about: the learner. Given everything we've heard about these often hidden burdens, how can we as individuals, as a healthcare system, do better? How can we make sure we're not just aiming for wound closure, but for a genuinely better life for people dealing with this? Maybe it comes back to constantly asking how we balance medical goals with what truly matters to the individual patient, respecting their well-being and their choices. It's complex, for sure, but definitely worth thinking about. Thanks for joining us for this deep dive.